right, this is going to be a doozy. So the cause of lower back pain, to figure that out, right, we need to take a step back and we need to look at the different tiers associated with the treatment of lower back pain. So we're looking at traditional medical model, which is a pathoanatomical model, which means that if we see this, we treat this. If you're feeling this, we treat that. It's really based off of structure and trying to find that specific issue and then treating that specific issue. And then let's dive into the therapies. And then the conservative treatment approaches include physical therapy, chiropractic, massage work. And then let's dive into what the evidence is showing and what I've seen in my experience and what I've seen actually improve people. So let's go through those three categories and have some fun along the way. So let's go over the traditional medical model. So the traditional medical model happens like this. You have some sort of discomfort, and the research shows that when you have back pain or lower back pain, we tend to either go towards chiropractic or primary care physician first. And so let's say you go to your primary care. You say you have lower back pain. And I've seen a few things happen here, right? Either they tell you to wait and see, or they say, hey, let's get an x-ray or MRI based off of your discomfort. Let's maybe prescribe an NSAID or muscle relaxer, or just give it some time. And all of those things tends to be options of primary care provider. But when you see treatment options such as x-rays and MRIs for lower back pain to try to identify a specific area or a specific segment involved, so let's say they think it's their lower back or sciatica or piriformis syndrome, and when you try to do imaging to find those things, we often don't find those things. We tend to find things such as age-related changes or disc bulges or disc degeneration and try to label that person's discomfort with those labels and say your discomfort's caused by disc degeneration or your discomfort's caused by piriformis syndrome. And we tie that correlation based off of what you're telling us and what you tell the primary care provider, and then also what they see on your image, x-ray, MRI, and they may give you an NSAID or muscle relaxer along the way depending on kind of what you're telling them. And so that's the pathoanatomical model, in that you go in, you see that provider says, hey, let's get an image, x-ray or MRI, and then let's see what that image says, and let's follow up and let's go from there. Well, the challenging part of that is a couple things that I really don't like is that, one, they do the image, but they don't actually follow up on the image. They rely on the radiologist report, and they may or may not decipher that radiologist report with you. So let's say that radiology report reports disc bulging. They do an MRI, they find the disc bulging. Well, the problem is like 90% of people have disc bulges if you're over the age of 30. So to say that like, hey, like your pain's caused from a disc bulge, that's very, very hard. And that's a loose correlation. But what we've seen in the research is that when you go through that path of the x-ray, MRI, try to explain back discomfort, we see that since the invention of these technologies, they've increased exponentially in the use of clinical pathways. So like they're happening a lot in the medical system. But what we've also seen increase exponentially at that same time is the number of injections and surgeries for back discomfort. Well, if that were good, we would notice that everybody would go through those pathways and then everybody would have some sort of relief or permanent relief from their back pain. Well, that doesn't happen, right? We actually see that disability is still increasing over time. So the amount of people unable to do the things that they want to do because of back pain, even when they go through those pathways. And so you're receiving the images, you're receiving very little education, and then you go down a pathway that is very loosely evidence-based, and your outcome isn't as good. And finding the root cause of back pain does not come from an image or an x-ray or an MRI. I'm sorry, it just doesn't. I've seen it way too many times, and people very disappointed in their clinical pathway when they try to go down that pathway with their primary care or whomever, and it's just not getting the results that they were looking for. So the traditional medical model tries to label your discomfort with a certain pathology, right? And what I talked about earlier is that 90% of people have disc bulges if you're over the age of 30. Well, that's an anatomical variation that you didn't have, let's say, early in your life, but that does not mean that's what's causing your pain. And when we try to do that with lower back pain, not only do costs increase, people's frustrations increase, they're not getting better like they would expect, they're staying more pain for longer periods of time, and they're just not happy. They're not having an enjoyable medical experience, and we're there to get people better, and these people are not getting better when they're receiving imaging as a frontline treatment. We see this 100% of the time in the research. It is very well supported, but unfortunately that pathway tends to be supported because of the traditional medical model in regards to pain with insurance. And so when you're looking at the medical model and we try to label back pain with some sort of variation that they see on the image, that pathway isn't great. So now let's talk about therapies in regards to back pain. And when I talk about therapies, I'm really meaning like conservative approaches such as physical therapy, chiropractic work, massage, acupuncture, etc., etc. And then I'm a physical therapist myself, and I tend to lean towards these conservative treatments because that's what the evidence shows. But I think the model that we're trying to use those therapies and find the exact cause of back pain has changed. And so let me give you an example. When I first started being a therapist, I used to think that the delay in muscle activation would cause back pain. So like your core wasn't tight enough or activating at the right time to cause specific back pain. And that was challenging because I would try to focus on improving people's core, and I'm like, hey, tell them to brace and try to contract things before you move. Well, then that's not a behavior or pattern that we were doing before when you were not having back discomfort. And that I really don't want you doing that for the rest of your life, because that kind of inhibits you from doing other things. So you shouldn't have to think about things that hard for your back pain to go away. And so we have things such as dry needling and massage and acupuncture and soft tissue mobilization and manipulation, all of these different treatments to try to improve back pain. And that it's challenging because if it worked 100% of the time, everybody would do it and they would feel better. And the problem is that those types of therapies, when you try to explain their cause of back pain and use those therapies to treat it, it gets very challenging. It's a little bit cloudy. It's a little bit, I would say, it just makes things feel a little bit weird because the patient is really wanting to find their exact cause, which I think they need from an X-ray and MRI, but that requires a lot of education to try to change that script a little bit. But then you're trying to explain, okay, like you are subluxed, and so you need a manipulation or an adjustment to fix that. Well, if we dive into the research, like we can't even describe a subluxation. It's if you find it on an image or X-ray, and then you try to treat it, and then you would expect a change in the image of X-ray and a change in your symptoms. Like those things just become cloudy, and at best they're variable, and at best the patient responds with short-term or medium-term relief, but it may not affect it long-term. And so the therapies just get into a little rut, thinking that their specific treatment or ritual or whatever you want to call it is going to be the cure-all for your back pain, and that's challenging as well. Like we can't say that definitively. And so when I first started my practice, I was very much leaning towards that side of things. But now when we're starting to learn more and more about back pain, and when I've seen a lot more people getting better, is when I try to go to a different approach of back pain, approaching it more from the human being, a 15,000 foot view instead of a 3,000 foot view. And let me explain what that looks like and feels like. And the more evidence-based approach is more taking a 15,000 foot view to someone's health. And so when we talk about spine pain, it's usually a representation of that person's health, mental and physical and emotional, all of those things and interplay with back discomfort. And so the way the history of back pain has been is like, oh, we don't know what's causing it. Let's really zoom down and try to figure out what's causing that discomfort. But then the research says, whoa, you need to take a step back and look at the overall person's health and how they think and feel about their back discomfort. And so a true evidence-based pathway of back pain looks at how you move, right? We need to look at the back, and then we need to look at how you think and feel about the back. And then as a provider, we need to understand the different systems at play to improve back and discomfort. And so when you're finding the root cause, well, the root cause is very individualized. Everybody's root cause of back pain is different. Every person's back pain is different. And that's why some treatments work for them or your friends and not work for you, and the other way around. And not one patient I've ever seen has had the same pathway for their back pain. We need to look at how they think and feel about their back pain, what their lifestyle factors are like, what their back actually looks like. What do we need to improve physically to help give you the best chance for recovery and prognosis, and like what are the modifiable factors, what things we need to change and what we can change, and what are the non-modifiable, like what can we not change? Maybe it's your work or maybe it's your life. And so all of those things we need to take in consideration when we're treating back pain and finding the root cause of it. So the root cause of back pain is very challenging to find because everybody's back pain is very, very different. Their experiences are different, their life is different, and that's how back pain needs to be treated. It is not a one-size-fits-all approach like we have for other conditions like carpal tunnel or et cetera, et cetera. Like back pain is much more challenging and it's much more involved with your whole body, not just your specific location and back, and not just one issue in your back or one structure in your back. If you're looking for short-term and long-term relief, you need to find a provider or somebody that's willing to sit down with you, talk with you, look at your back, look at how you move, talk about your life, think about your thoughts and feelings around your back discomfort. I know it sounds weird and I know it may not be intuitive, but trust me, it needs to be done. And if you could do that with back pain, you can set yourself up for a future you want now and a future that you want later in life. And those things just need to be done. That's what makes back pain so much fun to treat and so challenging at times. And so I know some of this may be new. If some of it resonates with you and that you feel like, you know, some of this makes sense, subscribe and like leave a comment. I would love to engage in some discussion. I know it can be frustrating at times, but just hang with it. Find somebody that's more evidence-based. Find somebody that will actually sit down and listen to you and take the time to look at your back and then look at the other things as well that need to be looked at. But guys, hey, I really appreciate you guys hanging around and talking about this stuff. It is not all inclusive. I know I'm not touching about everything, but I hope you guys find something from this video. And as always, guys, stay healthy, keep moving, and take care of yourself.